It's a topic some feel uncomfortable talking about, but tonight a local father wants you to hear his emotional story after his daughter took her own life just 2 weeks ago.
According to the American Foundation for Suicide Prevention, suicides among young people are going up at an alarming rate. And Richard Blackwell of Tucker is hoping by sharing his story, it'll prevent another family from going through this unbearable pain.
Fox Eye's Nathalie Pozo spoke to that grieving father. And Nathalie, what's the most important thing Mr. Blackwell would like us to understand?
Well, when I spoke with Mr. Blackwell earlier today, he tells me that after this tragedy, he absolutely knew he wanted to tell his daughter Alex's story and wants parents whose child is telling them that they're okay to ask again and make sure. His 16-year-old daughter was saying she was okay, and a day came when she just decided it wasn't worth going on.
Good night. I love you. Night, Dad. Love you.
Those are the last words Richard Blackwell heard his 16-year-old daughter say. Alex was smart, funny, happy, with dreams of attending college. The sophomore was a forward on her soccer team.
Everyone always said, when we're feeling down, Alex makes us feel better.
But Richard says last fall he and his wife noticed a change in their daughter after she received a concussion during a soccer match.
The anxiety went up, her level just of unhappiness started creeping up, and all of this was very little subtle incremental things. There weren't big jumps. It was little things.
Richard tells me his daughter was depressed and they got her help from therapy to medication, and as her parents they would sit down and talk to her.
When I spoke to her, how are you doing? She says, I'm okay, Dad. I'm okay. I mean, she knew what I was asking. Are you okay? And I think in some way she was tired of always all the, are you okay?
Richard says things were moving in the right direction until they were woken up by a late-night pound on their front door 2 weeks ago that would shatter their lives.
I opened the door up and there was a policeman there, and he says, if you've got a 16-year-old daughter, you need to check on her now. And we ran up to her room and we found her. And she wasn't breathing, had no pulse.
Richard and his wife began CPR. Medics arrived and rushed Alex to the hospital. For 2 hours, Richard says they tried to save his daughter, but it was just too late.
They let us sit with Alex for a long while afterwards. We held her hand, kissed her cheeks, until it was time to go.
This is part of a moving, emotional article Richard wrote just hours after his daughter took her own life. He says it was Alex speaking to him.
I wanted her message out, the message I think she gave me to pass out.
The data for teen suicide is frightening. It's a generation that's at risk.
Over the last 9 years, all of them have had significant increases in terms of percentages.
According to the Center for Disease Control and Prevention, more than 2,000 teens ages 15 to 19 committed suicide in 2015. Since 2008 to 2015, it more than doubled for children 10 to 13 years old.
Maybe more stressors in terms of modern day life. And while you have perhaps a lot of connection in terms of electronic connection, you don't have perhaps as much connectedness in terms of physical interactions. Connectedness is one of the strongest protective factors for suicide.
Roland Bayham is with the Georgia chapter for the American Foundation for Suicide Prevention. He says parents should not be afraid to ask whether their child is having suicidal thoughts.
A lot of people think that if you ask the question that somehow plants the seed in their mind, but all the research shows that not to be the case. That in many instances, by asking, you're the first person who gives the opportunity to the person to say, yes, I have been feeling suicidal.
Suicide had been something that Alex said she'd considered in the past, and we took that very seriously.
But Richard and his wife did all they were supposed to do, and Alex kept telling them and her therapist she was okay. That post has reached thousands of people. Richard says he's received countless emails about how his words in a moment of heartache saved others, and he hopes that by continuing to speak out, it will prevent another family from tragedy.
This is a very difficult time for teens. During this time period, they don't want to talk to people about it. They don't want to talk to their parents. They're embarrassed, or they feel that their problems can't be overcome. The first component certainly is we need to be able to tell them a lot of this is normal. Some of the things that happen maybe aren't so normal, but we can get past them. Just get past those teen years. That's the hard part that I'm not sure we did a good enough job with Alex. She was always happy. We didn't worry so much about her. When all along she was hurting on the inside.
And there are several suicide prevention resources in our area. The American Foundation for Suicide Prevention says the crisis text hotline has been very effective. You can send a text to 741-741 24 hours a day, 7 days a week, and they will respond to you immediately. You can also remain anonymous.